what come to adapt NCLEX? But the NCLEX is the large portion of it or select all that applies. The reason why they do that is because they want you to know your content, whether it's a risk factor question, whether it's a teaching question. And so I will demonstrate how this is done. This is the way I approach certain questions. First, you got to know what is being asked. If you don't know what is being asked, you can't answer the question. And to find that is to look at the last portion of the question. And the next anticipate which assessment finding. So we're looking for an assessment finding, so expected finding. Then you go for the case. Read the rest of the question. A client with type 1 diabetes with priority diagnosis of DKA. So that's the case. Patient with the type 1 diabetes now has a DKA. What then you go for your buzzwords. What are my buzzwords? Type 1 diabetes, DKA, and an anticipated finding. Those are my three buzzwords. Then rewrite those buzzwords. So that means I have a patient who is in who has a type 1 diabetes, is in DKA. What should I see? I have to take ownership of the question by rewriting it. Then after you rewrite it, fill in the gap with your content before. Then you make a choice. You start from the top and you go down and you make a choice and you move on. Never look at it again. Don't compare any of these answers together. They are independent from each other. If you look at one answer choice to the question, your chance of answering it is 50-50. So before you answer these questions, take like maybe 20 seconds and then figure out your content and take that content information to answer the question. So here you said, what are we asked? Diabetes, type 1 diabetes. You got to think about the content. So in type 1 diabetes, the major problem that happened initially is sick day. When they go in DK, sick day. Patient is sick. He has some form of sickness or upper respiratory infection, some cold, and they don't want to eat. So no food, and they don't drink. And then they decide, I'm not taking my insulin because I'm not eating, which is a mistake. No insulin, okay? Since they are type 1, they need to inject themselves. They will say, I'm not eating, so I'm not injecting myself. You have sugar, glucose build up. And what does glucose does? When it build up, it causes osmotic diuresis. And they lose a lot of water and they become dehydrated. This is the physiology of the disease process. They get dehydrated. And then there's other things that happen. This is what happens. You need insulin to push potassium inside the cell. You need insulin to push glucose inside the cell. Guess what? They have no insulin, and the body needs some energy. The brain and all the organs need energy. They force the body to use fat. You break down fat into ketones. And these ketones, you develop acidosis. So ketoacidosis. These ketones can be used by the rest of the body for their energy. Unfortunately, what happened? Ketone smell. So they have fruity smell, okay, from the ketones. Because they don't have insulin, they cannot push potassium inside the cell. So potassium is high. Their glucose is also high. They cannot push glucose inside the cell, right? They are dehydrated. So dehydration, right? They smell like fruity, right? And then the ketone, they make metabolic acidosis from the ketone formation. The formation of the ketone causes metabolic acidosis. Guess what? Now the body start to go into recovery mode in order to get themselves out of this trouble. If you have metabolic problem, you should have respiratory compensation. If you have acidosis, you should have alkalosis compensation. So they will be having respiratory alkalosis. What does that mean? This is the deep, rapid breathing. And this is the Kushma breathing. That's what we call Cushman. So one of the symptoms they will have is Cushman breathing. Look at what I've done using pathophysiology to give you all the signs and symptoms of DKA. Therefore, if they come in, what is the problem? Look at the definition. Pathophysiology. Pathologically, this is what is happening. The cells cannot take in glucose. Physiologically, he has shown these signs. These are the signs. Smell fruity, dehydrated. Therefore, in order to fix this problem, is to go back to the pathology. Go back to the pathology and fix the problem. What is the pathology? Inability to put glucose in, and the end result is what? Dehydration. So dehydration is your number one problem. Dehydration. So that is number one. So when they come in, you give them what? Fluid. You give them fluid, 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 followed by insulin, then glucose. So this is the way the management has to go. Insulin, glucose, and then potassium. You can flip the potassium from the glucose, but this is the way it flows. You give them fluid, insulin, glucose, and potassium. So we're going to take this information to answer the question. Now that we know what happened. And we take those information and bring in and compare. Fruity smell, expected. Rapid deep respiration, Cushman breathing. Glucose 700. Their glucose will never be 700. Why? Because your body will not let you build up that glucose since they don't have insulin. Because they don't have insulin, as soon as the body realizes that the glucose is going up, maybe they up to 300, the body will get into the recovery mode, start using ketones because they lack insulin. This is what happened in HHS. Why? Because they have insulin. They need extra insulin. And so they trick the body. The body is able to push some glucose inside the cell. So they wait until the glucose are built up until the body said, no, 700 is too much. So they will never get to 700. Their pH is supposed to be acidic. This is 7.45. Therefore, this is wrong. Potassium is 5.6. This is true. In the beginning, their potassium is high because there's no insulin to put potassium inside the cell. As soon as you start treating them, potassium go inside the cell and their potassium become low. That's why you have to replace their potassium when you're treating them. So this is true. Dry mucous membrane. This is typical of your exams. They will let you know certain concept and then they ask you something else to apply. We know number one problem of DKA is dehydration. Therefore, for this one, dry mucous membrane is consistent with dehydration. Abdominal pain, yes, is from all the dehydration and hyperglycemia and the sickness, they have abdominal pain. This is the way you answer such a question. You ask your case, your buzzwords, rewrite it, get your content, take it with you, and analyze each question, make a choice as you go down and keep on going down. Don't compare. The only thing you compare your answer to is your buzzwords and make sure they satisfy that. And when you finish, check and make sure those you want to pick and you move on. Never compare answers. This is how you do it. And this is the secret sauce for SATA. Take care of yourself, keep charging, and subscribe to the channel for more content like that. Take care of yourself. Bye-bye.